welcome back to MSNBC Live. We're going to go right now to House Speaker Nancy Pelosi, who's speaking about health care, again, understanding that she's having trouble in the House rallying her troops, but there's still expectation that there could be a vote next week. Let's listen in to House Speaker Nancy Pelosi speaking about health care legislation.
Molly Secores of Nashville, Tennessee, whose medical debt from uterine cancer could result in foreclosure on her home. Catherine Howard of San Francisco, California, and Jacqueline Mikolos of Norwood, Massachusetts, who both beat cancer but had radically different experiences with their health insurance. America's Affordable Health Choices Act takes a number of steps to ensure that when Americans face a health crisis, they also don't face a financial crisis. Consumers will have more choices so they can find plans without waiting periods and high deductibles. There will be an annual limit on out-of-pocket expenses and no lifetime limits on care. There will be no more co-pays or deductibles for preventive care that can catch devastating illnesses in time. And if you change your job or lose your job or have a pre-existing medical condition, you cannot be denied coverage. I'm now pleased to introduce our caucus Vice Chair, Xavier Becerra. Javier serves on the subcommittee of the Ways and Means Committee that is helping lead this health insurance reform effort. He's been a very valued member of our caucus in leadership on this issue. Mr. Becerra.
Thank you, Madam Speaker. For those who think that this has been an artful game of political or policy chess, hear the stories of the people that are with us today. This is the real deal. This is about finally giving people a real sense that health care will be there for them and their families. And if anyone thinks that the stories that are being written today about where we are in this health care discussion are simply stories about Washington, D.C., then you're sorely mistaken, because the real stories that this is all about are here today. In some places in America, people think they have good health insurance. In some places of America, too many Americans have found out that they don't. We intend to change that. America's Affordable Health Choices Act means to make it possible for no one to have to worry that the health insurance they have will not be enough. Molly Secor has a story to tell you. She's a small businesswoman. She was doing very well. And then she found out she had uterine cancer. She has and had health insurance. And so, like all Americans who have health insurance, she thought she'd be okay. Until her insurance company told her, "You're a little too sick to be helped." And so her catastrophic coverage didn't take care of what she needed. And today, like many Americans throughout this country who are on the verge of losing their home, Ms. Secor had to take out money from her home so she could pay for some of her expenses. And today she's one of those many Americans who is not sure if she's going to get to keep something as important as the roof over her head. Now, these stories go on all the time, but Molly Secor's story is no different from the story of many Americans throughout this country. And so while we write about and read about these tales of political and policy discussion and debate, the real stories are here, and I'd like to introduce to you Molly Secor.
Thank you. Good morning. Again, my name is Molly Secor, and until about 2 years ago, I was a fairly healthy freelance filmmaker. I prided myself on being responsible, a responsible, single, self-employed person, and I did the smart thing. I went out, I got a low-end health care policy with a large deductible. It was a catastrophe insurance policy. I told my friends that it was my bus insurance in case I get hit by a bus, and that's pretty much how I felt, and I was pretty healthy, so that was safe. I know that might sound dramatic calling it, the in case I get hit by a bus insurance policy, but I'm a filmmaker, and what happened to me sometimes feels more like a movie than actually my life. 2 years ago, last month, I got hit by the bus. I heard those words, the three most terrifying words that you can hear in America: you have cancer. When you hear those words, it's like stepping out of the shower into outer space. You're disoriented. None of the normal rules apply of life, of the universe. Everything becomes surreal. This can't be happening, not to me, how? And when I finally found my tongue and the first things out of my mouth were, I know I can't afford this. Never mind that it was stage 4 uterine cancer and it had spread to the lymph nodes already. It was requiring an immediate radical hysterectomy, and that I was facing that I was no longer going to have the possibility of having children. The first words were, but I can't afford this. Never mind that there was a harrowing chemo cocktail and radiation cocktail that I was about to endure for the next 6 to 8 months of my life. That meant I would never be the same. I was consumed with the fear that I'll have to declare bankruptcy. Never mind that I was being told that the key to my recovery was to remain stress-free. Just stay stress-free. And all I could hear was, I'll probably lose my house. And so my healthcare nightmare began. The lethal cocktail of chemo required these mega anti-nausea drugs, and they were $500 a shot, $500 a round for each chemo. I had 6 rounds of chemo. I had to call cousins in Canada to see if I could get it cheaper because I couldn't afford it because my insurance company wouldn't pay for the chemo drugs or the anti-nausea drugs. After the first 5 rounds of chemo, I got the first bill in the mail. It was a 4-page itemized bill, and one item on the bill for the first round of chemo, the first of 6, was for a shot of Neulasta, which was almost $6,000. That was one item on a 4-page bill, and I about passed out knowing that just $36,000 I was going to have to look forward to receiving bills just for that one shot. So some days when I got the bills in the mail, that was almost as excruciating as the harrowing chemo treatments that I went through. And there were days when I prayed that I wouldn't make it because I didn't want to face what was waiting for me on the other side should I make it. But I survived cancer, and last fall, less than a year in remission, I had to battle with my mortgage company who had put me into foreclosure. Even though I'd never been late, I never missed a payment during the entire time of chemo and radiation. There was no leniency because I had cancer. I had a subprime mortgage because I'm self-employed. And if it weren't for the fact that I knew Tennessee Congressman Jim Cooper, I wouldn't have a home right now. They rallied for me, the press rallied for me, and I ended up getting to keep my house. So I didn't lose my house. But it shouldn't take an act of Congress for someone who has cancer to keep their house. So I tell you this today, being 15 months in remission, knowing that my continued recovery depends on keeping my stress low as I chip away at tens of thousands of dollars that my health insurance company didn't cover. And it wasn't that I wasn't responsible. I did the right thing. I bought the insurance with a major carrier, and still it wasn't enough to prevent me from nearly losing my home. And now that very same policy has doubled, and I'm terrified to get another one because I know that now that I have cancer, I'm a marked woman. There are 47 million people without insurance in this country, and they're not looking for a handout. There are thousands of people like me who have insurance, and they're not looking for a handout. We're not looking for a handout. What we're looking for, what we're asking for, what we're begging for, what I'm begging for is a current health reform package that becomes law so that people like me can receive adequate health care and aren't fiscally and physically ruined by getting a diagnosis of cancer. Thank you very much.
Good morning. I'm Congresswoman Donna Edwards from Maryland, and thank you, Speaker Pelosi, for hosting us this morning. And especially thank you to our guests who